This conference will now be recorded.
But Ariel, you may want to mute yourself for the moment.
Okay. Okay.
Hi, this is Claire from the Oregon Primary Care Association. We're going to wait a little bit for folks to get on, but Malia, will you advance one slide for us? Thanks. Okay, we're going to go ahead and get started. This is Claire Trinquez. I'm the Deputy Director at OPCA. And we know we had initially planned to be doing a all peer group gathering at this time with the topic of health equity, but as hopefully most of you have seen, we've actually decided to delay that for a few weeks, and instead we wanted to create a space for everyone to talk about our most pressing issue right now. So I'm just going to do a brief overview, and then we've got a few things to share before we do an open space for all of you. Will you please move one slide forward? So yeah, we just want to take a moment to welcome you all and you know, acknowledge what is going on and connect a bit as a community. We have some updates for you around emergency reporting, some wildfire resources, a little bit in the advocacy and policy support space, and then really we want for all of you to be able to discuss important items that you would like to with each other. If you are not presenting, please do put yourself on mute, and then you can unmute if you do have a question or anything as we go. All right, so with that, I am actually going to go ahead and turn things over to Joan, our Executive Director, to give just a brief welcome.
Thanks, Claire. I just want to thank you all. Can you hear me? Okay. So I just want to thank you all for joining us today during this difficult time. I know you all have a lot going on right now, so appreciate you spending an hour with us. As Claire said, while we had hoped to be spending this afternoon with our members for the executive peer group gathering to focus on the important topic of health equity, we really felt it important to pivot due to the wildfires and the need for response to that, and hold this time still to just listen and share and support one another, in addition to helping to identify how we can best support the emerging needs coming from our members. So we all in the greater Oregon community are part of this greater community, and the impact of the wildfires is truly devastating and heartbreaking. At the same time, it is heartening to see all the heroes out there and the acts of heroism and kindness throughout our state that we've been seeing and hearing about how community members are coming out to support one another and really providing comfort during this difficult time. So just want to thank all of our member health centers for continuing to serve their communities, and we hope that you and your loved ones are staying safe during these disasters. And I'm just going to turn things then over to Ariel, since I know we have limited time together, and I look forward to having the opportunity to listen and hear from all of you.
Okay, so Malia, can you advance to the next slide, please? So we thought we would start with just a moment of relaxation and centering, given how very stressful this situation is on top of the ongoing stress of 2020 that we've all been feeling. So this is actually a photo from Opal Creek, which is one of my favorite places in the world, and is impacted by the fire. So, excuse me, I thought I'd share a beautiful place in Oregon for you to look at if you choose to, or to close your eyes for a moment. And we're just going to spend a minute or two doing a guided relaxation reflection together. So start by making yourself comfortable in your seat, or you can stand up if you like to feel grounded in that way. And take a couple of deep breaths, starting to let yourself let go a little bit. With each breath, notice where you're holding tension. We all have our usual spots for doing that. So you know whether to look in your neck or your shoulders, your back, maybe your gut, and see if with every breath, you can relax and let go of some of the tension that you're holding on to. You might want to lift your shoulders up towards your ears, and with an exhalation, let them roll down your back. With each breath, relaxing a little bit more. And as you begin to feel a bit more relaxed, turn your attention towards a feeling of connection. However you arrive at that, maybe it's through your heart or your mind, your belly, your body, trying to find a feeling of continuity with the people and the world around you. That sense of interdependence and support that we can use to gain strength and reassurance from each other. And with another breath or two, feel yourself settling into that sense of connection and relaxation. And then in whatever way feels meaningful to you, maybe offer up a thought, a prayer, a blessing, well wishes, whatever makes sense to you in a time that's feeling pretty senseless, to offer support for people who have been directly impacted by the fire, creatures and plants and trees. Homes and businesses. So offering well wishes to all of those impacted directly, and certainly also all of those impacted by the terrible air quality that we're all experiencing. You don't have to be directly impacted by this set of fires to really be feeling the effects of it in a really fundamental way. And then finally, turn your attention towards some feelings of gratitude. Again, whatever is meaningful to you, whatever you're feeling grateful for. Connecting to your own feeling of strength and abundance and resilience that will help us get through such a difficult time. And know that you could come back to such a little practice at any time if you're feeling like the stress is getting in the way of being able to go about your business or take care of what you need to. You know, you can always take a couple of minutes to slow down, take some deep breaths, connect, and refill your tank in that way. So thanks for those moments of presence, and let's move on now to the next slide. Okay, so we wanted to, in addition to having that moment of connecting in that nonverbal way, we also wanted to connect with you guys in a more explicit way to hear how you're doing and to share how people are feeling on this Monday. And we thought we would do that in two different ways. So one is to use Mentimeter to hear from the whole group at once. So we're going to use this Menti code that you see on the screen to create a word cloud of how the group is feeling. So of course, word clouds work best when we use single words rather than phrases. So think about the top 3 words that describe how you feel right now. Could be emotional, could be things that you feel like are right at hand for you, coming up for you in whatever way. It's totally up to you. Leah's going to pull up Mentimeter, and so you can start thinking about the words that you'd like to share. And the code is in the chat, and we'll start to see the words coming up here, and wanted to, in addition to having people share this way, to just actually open the floor for people to talk about how they are and what's going on. We don't have time to hear from everybody, so we thought the word cloud would be a good way to hear from the whole group, but also wanted to make space for people to offer some kind of narrative sharing and excuse me, actually speak to each other. And also, I think, you know, being able to see each other is really powerful. So if you're willing to turn your camera on, I think it's reassuring during a difficult time to actually see the members of your community. So wanted to invite you to do that, and also just see if anybody wants to speak up. And we will have some more opportunity later in the call for sharing. But I do, no one is speaking up. I want to give us another moment here if anyone would like to, and then know that there will be asking additional questions beyond just how you feeling later in the call.
Ariel, this is Gil. So I'll share a little bit. You know, we are, yeah, it just feels like one thing after another, you know, from COVID, you know, into the fire situation. And so as we're really trying to respond to the needs of our patients and staff and community during this time, I'm also reflecting on the fact that, you know, fortunately, because of COVID, we've developed certain systems in place to allow for responsiveness to these emergencies, and that I think is proving to be really helpful at this time. So I feeling you know, the stress and anxiety around, you know, dealing with this, but at the same time, grateful for the resiliency of our teams and people coming together, and a sense of being resolved, you know, to address this and committed to improving and doing what we do best as community health centers, which is really responding to the needs of the vulnerable and, you know, our community. So yeah, lot of conflicting feelings.
Mm-hmm. Yeah. Thanks for sharing that, and for the positive framing, that, you know, really finding the silver lining and focusing on our strengths as a community. Anyone else have any thoughts that you'd like to share?
Hi, this is Marlene, County Community Health Centers. I would echo a lot of what Gil said, but also something on the positive side that I'm feeling is really a strong sense of community, whether it's community in support of people who've lost things, support for people that need resources, support for each other just as a whole community. So I'm grateful for that.
Thanks for sharing that, Marlene. I agree. It's often the most difficult circumstances that bring out the best in us and enable us to really show up for each other in a positive way. Anybody else want to share anything before we move on? Okay, well, why don't we keep going? And as I said, we'll be asking in the latter part of the call for more thoughts and questions and priorities from you. So be thinking about what you might want to share and hear from your colleagues as we continue.
Thank you, Ariel, and thank you, Malia, for moving the slides forward. So this is Sonia, the Sustainability Manager at OPCA. I am going to talk a little bit about our emergency reporting expectation. HRSA expects that OPCA reports to them health centers that have had adjustments to their operations. So I am sure many of the operations peers have received quite a few emails from me over the past week asking about what your operations are. We are going to try and do that in a more streamlined manner so that you're not receiving so many emails from me. Malia, if you could pull up the OPCA website. There is now a specific page on OPCA's website for the wildfires, and there is a link to a new form on there that we will ask you to fill out. It should take you just about 3 minutes or so. And if you look at the bottom of the second paragraph under emergency reporting, you'll see OPCA has developed a quick survey to streamline this process. That is the link, but I will also be sending the link out to you to complete this survey. It looks a little bit long, but it's actually very quick, and we ask that you just fill it out for your main site. And then if any of your other sites are affected, there are places in the comment section that you can complete that. Hopefully I'm not going to have to send this out to you more than once a week, but hopefully circumstances will not require that. And I want to also thank everyone who responded to my emails for information. We were able to report that information to HRSA so that they are aware what is happening on the ground. And if you have any questions about that, please feel free to email me. I'm happy to talk about it. I really want to make sure that we are reducing the burden for you guys, but also that we're streamlining it as making it as simple as possible. Okay, Malia, I think that is it. And yes, I'm sorry, Irma asked me if we are going to be sending the results back out in some way. We will most likely be sending those results back out through the operations group. The other thing that the form has is a space to add any other contact information for anyone else in your clinic that we should be contacting. So you can fill that out and put that in there, and then we would contact that person instead. And then for wildlife resources, OPCA has a Wildfire has a wildfire site now. There is also the link up there for Direct Relief, which is an organization that you can sign up with to get emergency supplies and medical supplies. We should have more information on that coming out soon. And then the last link there is for local and tribal emergency managers for your county. If you click on that list, you should find the county emergency manager for your county. I'm sure all of you have had some connection with your county over the last week, but that is a list you should hang on to. Okay, does anyone have any questions?
Have a great day.
Okay, Malia, you can move on to the next one.
Which is my slide. So good afternoon all. I'm Danielle Sobel, the Policy and Government Affairs Senior Director at OPCA. And I'm going to just really quickly give an update of kind of where we are on the advocacy and policy side, and then get out of the way so we can have open discussion and turn it over to all of you. The slide in front of you, I just put a couple of resources. Wanted to highlight that we did get the federal emergency declaration, so that allows FEMA to come in and certainly draws down different dollars. So I actually linked that there for you, and then listed the counties that actually applies to, which is a good number of our counties. Also wanted to highlight that the governor, in addition to her daily press briefings and a lot of the pieces that you probably have seen or been working with if you've been in these counties, has also issued an executive order, and that's Executive Order 2042, that prevents the price gouging for supplies and services related to wildfire. So again, that's just to prevent anybody from taking advantage of the situation of getting those needed supplies and services that you might need. So again, that's linked if anybody needs that or is curious, or if you experience any of that, please let us know as well, and we'll get you in touch. And then the last piece I wanted to just very quickly touch on was a conversation we had on Friday, I think it was last Friday, actually with the staff from both senators' offices. So Senator Merkley and Senator Wyden, we have a standing actually meeting with them on a monthly basis. It was a really good opportunity to connect with their staff. They wanted to find out what our health centers were experiencing related to the fires, and are still keeping both our funding and COVID-19 top of mind. So you'll see I actually put a question on the slide that they would love to get a little bit of feedback around. So as we go into open discussion, I'm going to encourage you to think about it. You can either put it in the chat, or you can respond to it if you're having conversation around whether or not the wildfires and closures, your operations, how things are changing and how quickly they're changing, are impacting access to COVID-19 testing. And anything that comes out of this conversation, I will relay back to those staff. I do want to mention that those senators and Representative Greg Walden were actually on the ground and may still actually be in the state. But the pictures that are in front of you, there are actually all three of those members of Congress in Jackson County at the Jackson County Fairgrounds this weekend, again, assisting and getting on the ground with all of you. So again, just curious to know what the impact is. Anything you can share or want to share, again, feel free to chat that or to build that into any response and conversation we have in the coming minutes here. And with that, I'll be done. Thank you.
Malia, can you advance to the next slide, please? Okay, so we're going to turn now to our open space discussion. And of course, with open space, we do have some question prompts on the next slide. You're also welcome to discuss anything that you would like to share with or hear from your peers. So you can either ask questions, share experiences, etc. So the things that we had come up with as question prompts were to inquire from you, what are your most immediate concerns, as well as what are you thinking about in more of like a medium or a long range thinking in terms of impacts to your health center and community, and where you think you'll be needing to put your attention and effort. Also wanted to open the floor for you to ask each other what you're doing to handle wildfire and the related impacts. Of course, there I think are all kinds of sequelae from the wildfires that we're going to be uncovering for quite a while. And then, of course, how can we OPCA support you both, again, in an immediate sense while we're still in the state of crisis, as well as we start to hopefully sooner rather than later be shifting into recovery mode. So with that, I'm going to open the floor. This is really your time to speak with each other. And you can also put questions and comments into the chat as well. So we have both methods of sharing available. And of course, with this kind of thing, you know, the more people speak up, the more valuable it will be. I do see some comments coming in through the chat about the impact the wildfires will have on COVID with respect to people not being able to be outside and having to be cooped up because of air quality issues and displaced people, increasing just contacts that we've been trying to keep pretty minimal for COVID, spread management, and the mental health and stress impacts that we know people are already really struggling, and this will surely make things worse.
This is Claire, and I have a very operational question for folks. I'm curious if you've done anything in your facilities to deal with wildfire smoke, and how maybe you've mitigated any of that in your clinic environments.
Hey, Claire and everyone. Hello, this is Rob Trachtenberg from OHSU. Clearly not the most rural community health center by any means, and my thoughts go out to all those other CHCs who are much more in rural areas, and I hope you all are doing okay. I'm really worried about you guys over the past week and weekend and currently now. It must be awful. I know for Richmond, what we're doing just in terms of smoke, OHSU as a whole institution is on what they call modified operations, meaning that only essential staff are coming in to care for patients. And even though everyone else is generally working from home, but if anyone was able to work at home, they can and should, even if they were in a clinical environment. So doing more virtual visits, what have you. But essentially looking at it institution-wide as if we were in the middle of a blizzard or something like that. But clearly not the same level of you know, sort of distress and urgency around keeping people truly safe, you know, in terms of life and limb. So definitely recognize that.
So this is Casey from Aviva and Roseburg. I think for us here, we're fairly close to the fire piece. I think it just became, I don't want to say the straw that broke the camel's back, but it really hit us in terms of a lot of things going on. Our front entrance, if you haven't been here in a while, is completely tore out because of our building project. So we've had to redirect traffic and everything because of that. And then our contractor, we went into this hold pattern because we needed an environmental study that USDA said wasn't in the books yet. So we went on a hiatus with that. So we kind of have this hold pattern or half baked sort of front entrance, side entrance thing going on. Of course, COVID, we got super excited because we got 10 testing devices here. I think Terry did at South River. Some of us got that pushed to us, but FEMA redirected all the test kits. So we're just sitting here kind of like raging, like, you know, what the hell are we going to do? What's next? And then the forest fires hit. And it just feels like the series of things on top of, you know, things that would normally not all by themselves kind of impact you. They just keep layering and layering. And the challenge that I've put in front of my senior leaders and really myself as I look in the mirror is making sure that we maintain a sense of positive outlook without being too Pollyanna. Like, you've got to be pragmatic as you go through this. You know, don't sugarcoat or worry about panic. Tell the truth, tell it straight, but then not get too depressed about it. It's just a fine line to walk as you know, telling the truth, but not too much of the truth, if that makes any sense. So, but the little things are starting to add up for sure.
I think you're in good company there, Casey. It seems like from the Minty, as people are noting in the chat, that everyone's feeling really overwhelmed. Maybe we could go kind of region by region. Wondering whether anybody else from the southern part of the state wants to speak up. Here from Casey and Roseburg. Anybody else?
This is Terry from Road Community Health in Medford. So yeah, we've been hit pretty hard with Phoenix and Talent, and now we're facing the north end of Eagle Point up into Shady Cove and Butte Falls. We just basically got it all the way around us. I think that our clinics are doing pretty good. Some of the staff have unfortunately lost their homes. Some people are still displaced, but we are able to have our operations. I think our biggest concern, and I think Kalisa touched on it in her text, was, you know, basically we're worried about our staff going from COVID and now into these wildfires that have really touched them. We just feel that they have really been impacted, and we want to take time to take care of our staff. Their mental health is what we want to be able to support. So we're putting together some, going to be some talking points and some meetings together for our staff to join if they feel they need to. Along with, there's a lot of resources. This whole valley has pulled together so good with everybody that has been supporting. It's all over the valley where, you know, they're bringing in clothes and food and any type of resources, along with, you know, helping support with behavioral health and mental health, along with pharmacy. And that was probably, you know, a couple of the biggest ones was the mental health, behavioral health, and the pharmacy. People were frantic because they didn't have their medications. They couldn't get their medications. And so, but I think, you know, we're all here, we're doing pretty good. And we're just hoping this doesn't take out Shady Cove and Butte Falls also. So we're waiting.
Thanks, Terry. We'll hope that as well. Anyone else from Southern Oregon or the South Coast want to share anything? Maybe we can move up to the Mid-Willamette Valley if no one else. And feel free to speak up anytime as well. Anybody?
Hi, can you hear me?
Yes.
Hi, this is Flor Mounts in Klamath Falls, Klamath Health Partnership, and Angela Leach, who's in who's been on the chat, is here as well. Like she said on the chat, we have sort of been lucky in the sense that the fires have not been terribly close to Klamath Falls. The closest one here, though, is in Chiloquin, and that is pretty close. But the air, of course, has been terrible as everywhere else. I think I just wanted to echo everybody else's comments about how difficult this has been for our staff. We had staff who had to evacuate as well with the fire close to us. Thankfully, none of our staff have lost their homes, but they've had family that has been impacted. We are trying our best to keep our staff, our staff's mental health at the front lines. But it is very difficult, especially with one thing after the other. This year has just been so crazy. But it's good to hear everybody else. It's good to know what other people are doing and ideas that help. It's also, one of the questions I had and wanted to know is if as an FQHC, if anybody else is doing anything with the Red Cross or with helping their patients outside of clinic, basically. We were trying to figure out a way for us to be able to help our neighbors in the Rogue Valley, but we weren't sure how to do that other than individually making contributions or donations or things like that. But as a clinic or as an FQHC, how we would do something like that. So that's where we're at right now. We're all just here breathing the bad air.
This is Terry again. One of the things that we found out that was really useful for the community is we had our eligibility assistants go out to the fairgrounds and some of the schools to help with people getting insurance, along with our behavioral health staff have volunteered and went out also. So those are probably the biggest things. And like I said, along with pharmacy, making sure patients have their medications. So.
This is Simon Parker Shanes. I'm with OPCA, but I'm very down in Southern Oregon too. And I'm aware of quite a few staff from the community health centers volunteering in the fairgrounds, nurses and medical assistants, but I'm not sure if that's being centrally organized or if it's just kind of organically happening. But I'm definitely seeing the impact of the FQHC staff on their emergency response so far.
Majority of it has been driven by the county. They're setting everything up.
This is Carla Stevens. I'm with Mosaic Medical in Central Oregon. We have received about 250 evacuees, and we utilized our mobile medical clinic on Saturday and Sunday to visit the hotels where most of the evacuees are staying and to support them. As you can imagine, a lot of health-related issues from stressors, high blood sugar, high blood pressure. Prescription needs was a predominant focus, and we'll be partnering with our local hospital, the St. Charles Health System, today to see if we can't get a more concerted effort around prescription support, particularly those whose insurance may not be covering them based on location or the pharmacies we have available. The other thing is our outreach group, our community health workers organized 2 homeless shelters. So we saw tremendous health impact from our air quality to our homeless population. So we've done everything we can to move them indoors into cleaner air quality, and our mobile clinic is visiting those sites. Finally, we did have to shut down our drive-up care to limit risk of air quality exposure to our teams. And we've had to mobilize some portable air filtering HEPA type units to keep the inside of our clinics at a level that we can continue to see patients.
This is Sonia with OPCA. Carla, were those COVID testing drive-up care sites?
No, we have not started our COVID testing drive-up sites. We were doing drive-up care for patients who fell behind on A1C, blood pressure checks, and immunizations due to their concerns for coming into the clinic.
Thank you.
Does anybody from Lane County, Lynn Benton, mid Willamette Valley kind of area want to share what's going on for you all?
Hey, Ariel, this is Kristen Bradford with the Community Health Centers of Benton and Lynn counties. And while Lynn County has had some evacuations directly and utilizing their fairgrounds, and Lynn County Health Department is coordinating those staffing efforts. And thankfully, Benton County has not had any active fires or evacuation orders, but we have been receiving a fair number of folks into our area. I think the count right now is that we have about 600 evacuees at local hotels with Red Cross vouchers. And we opened up a couple of different facilities, including our fairgrounds, which has 50 folks in RVs and a lot of their animals. And then we also set up in the middle school to have clean air inside. And through, because of our relationship with the county and the Emergency Operations Center being coordinated through the county and our health department, we have been helping to staff the medical room at the fairgrounds and behavioral support as well as the fairgrounds and out at the middle school. Interesting conversation this morning that all of these people that are in hotels, we're not sure how long their vouchers from the Red Cross are going to last. And so even though we haven't been very busy at the shelters that we set up, that could change because the vouchers may run out and they may need to come to our resources. So we're trying to, we set up some protocols for urgent assessment and treatment through our health centers to be able to serve folks that are high risk and vulnerable, obviously, with the evacuation, but aren't empaneled with us, to be able to try to help them out. And that's just part of what's going on here. We feel unfortunate, but also worried for everybody's well-being.
Thanks, Kristen.
And this is Ron Jelm from the Community Health Centers of Lane County. Dr. Kincaid put in the chat box, we've called all of our patients in the evacuation zones in the first 3 days to give them help with refills. We knew that med refills was one of the issues as people ran out of their houses. They didn't necessarily grab their meds. So the data system was helpful in that. Certainly we've been impacted by both patients not being able to come in, but quite frankly, many of our staff who are in evacuation zones. And so we very quickly have been calling our patients starting last week and through at least Wednesday of this week to reschedule appointments to telemed or phone visits at the patient's choice. And about 60% of our visits last week were changed to telemed visits. The air quality here in the Eugene Springfield area is pretty lousy. Every day we've been hoping it's going to get better, and that hasn't been the case. So a lot of our staff and patients have been affected by poor air quality. And there isn't anything other than our facilities folks being able to change filters and so forth that, quite frankly, we haven't found any magic solutions to improving the air quality. We did distribute, the county distributed N95 masks to all staff this morning who wanted them. That may have helped just a little bit on that.
Thanks, Ron. Anyone else from that part of the state before we move on? How about the coast? Anybody from the coast want to share what's up or ask any questions of your colleagues?
This is Marlene Putman again from Tillamook County on the coast. I would say that a lot of what I've heard is what our response has been. We have had 2 locations for people who have been displaced or evacuated. We've sent staff out to those facilities to deal with prescription refills. It sounds like the very same thing, to address and assess or triage any health issues. Our mobile clinic is available. We have used our main clinic also to still deal with COVID response. And we've kept our COVID-19 line transitioned to add wildfire questions in English and Spanish. And we've kind of just updated trying to our social media with our partner, Consejo Hispano. I think staff have been displaced also, and there is no, I don't know who the last person who spoke said there's no magic tool that we can use to improve air quality. So changing filters maybe internally, and HEPA filters seems to at least provide some peace of mind to staff. We're still on standby for some folks who have been evacuated from Portland who have come to the coast, from Lincoln City who have come to the coast. So we're hoping for rain.
Thanks, Marlene. Any other coastal sites?
This is Ron from Lane County. I'm going to jump in just real quickly. I don't believe that Orion Falvey is on the call. Orchid Health out in Orchid. I did talk to him Thursday last week, and their clinic in Blue River is completely gone, burned. And so, you know, that's one of our colleagues who's lost one of their sites entirely.
Thanks for sharing that, Ron. Okay, how about Portland area? Extended metro area, we can call it.
This is Gil. I'll share, you know, we've just had to really limit what we're doing with any of our usual outreach efforts. So we had scheduled, you know, a variety of community-wide testing events. There's an outbreak at one of the nurseries that we're still planning to do tomorrow morning. But other than that, we're putting on hold events that are subjecting staff and patients to the poor air quality. We are actually closed today as a result of the air, and we were open with pharmacy services on Friday, but hoping to get back to normal operations tomorrow. I'll know in about 10 minutes after our team meets. So one of the things we have done is converted our usual COVID huddles and things to extend to dealing with the fire and smoke situation. So it's been helpful to have that in place.
Thanks, Gil. Others from the, let's call it Northwest Oregon, Portland Metro. Okay, how about the Gorge or Eastern Oregon? Or anyone else from Central Oregon as well?
Oops, this is Tim Hines at Valley Family Healthcare over in Ontario, Oregon. We really only have 2 major fires in our proximity, and they're still a good ways away. in Ventura and up around Cambridge in the Hell's Canyon area. So we've got a little bit of smoke. I think the AQI is about 110. So unhealthy, but not nearly as poor as you're experiencing over in your area. Have had a few discussions about kind of preliminary plan for if things worsen, but really the focus has been much more on COVID and not as affected by the wildfires as others. So we're thinking of you, and anything that we can do to assist, we certainly stand ready to do that.
Thanks, Tim. Any others from the eastern part of the state, the Gorge, Central
Hi, this
Oregon?
is Max from One Community Health. We're just, I think, happy and fortunate about not having a fire right locally. So thankful for that. And, you know, our hearts are with everyone who is dealing with an active fire situation. And obviously with the smoke here, we're just shutting down outside operations. And then we're doing our best to keep the clinics sealed off as much as we can, and then exiting any air. We did get new filters with our new clinic. It's got a very high MERV level of 15. It's really pretty comfortable inside of that clinic, but our other clinic is a little smoky and a little more challenging. So just doing our best to, you know, let people go home if they're not feeling well, and you know, make it as comfortable as we can.
Thanks, Max. Anyone else want to speak up? Well, how about we move on to the next slide? We thought that it might be nice to end on the positive. And so we wanted to ask people to share what are the bright spots that you've seen? Kindnesses, strengths, acts of heroism, generosity. We've already heard some of this for sure, but also wanted to just make time specifically for people to be able to talk about resilience and offer that reassurance to each other about the strength of the people in our state.
I'll share that our health and safety manager has become really adept at these incredible, you know, media. He's almost like a meteorologist, weatherman person that's able to give us up to the moment, you know, updates on air quality and fire and wind, and you know, with how it's modeling, you know, and so it's been great to see people stepping up and you know, being creative and using their expertise in ways to inform and really help us to make good decisions.
Thanks for sharing that, Gil. Other stories of strengths and kindnesses and generosity, positivity that you've seen and want to share?
This is Claire, and I just wanted to share how happy I was when I heard that the La Clinica Phoenix site is still standing. It is a little damaged in, I think, their power and internet, but that fire that blew through, I knew it was in that path, and they're still there, so that's good.
And a lot of that thanks goes to the firefighters as well, who really targeted healthcare institutions as sites for priority. They're right in the middle of the burn zone. So they got very lucky.
Thanks for calling that out, Simon. I have to say, just in looking at all the photos and stuff, and various media outlets, it really is humbling to think about the firefighters who are out there really defending all of us. And I feel enormous gratitude for their courage and bravery.
On that note of the firefighters, I was excited to see the bill that California passed about allowing inmates to become professional firefighters. I think that is a very important piece of legislation to pass.
Well, seeing as how we are almost at the end of our hour and not hearing a lot of people speaking up at this point, let's close with Malia. If you could go to the next slide, if you want a little story of some superheroes in the state, literal superheroes showing up. I'm putting the link to this news story in the chat as well. If you haven't already seen this, I thought this was so sweet. These are some young people who work for a party company in the Eugene area, I believe, who knew that the children who had been impacted by the fires might need some superheroes to brighten their day. So they went to one of the evacuee sites and spent time with the kids, and I'm sure they put a smile on the faces of some adults as well. So always nice to see the generosity and creativity of humans and showing up for each other. So Claire, I don't know if there's anything you want to say about next steps from OPCA or anything else in closing.
Yeah. Thank you, Ariel, for all of the great sharing that you helped us do today. So yeah, if there is anything more that any of you want to share with us after this, please do feel free to email. We will of course be in policy and advocacy spaces and sharing with you information about resources for recovery as we enter that phase. We will also continue to report daily to HRSA the updates about your sites and who is closed. So don't forget to continue to share that with us. And I think that's it for now. We'll look forward to seeing some of you on our rescheduled peer group gatherings that will take place in October now. And till then, stay safe and keep breathing through whatever means you need. Thank you all.